Hi, welcome to The Breakdown. I'm Ziad Kassab, and tonight's topic is education. So with us, we've got three very distinguished guests. Dr. Michael Basuito is with us today. He is a candidate running for the Wayne State Board of Governors, currently serving as a clinical associate professor at Wayne State as well. Member of many wonderful organizations and has treated thousands of patients overseas in Mexico, I believe.
In the Philippines.
In the Philippines,
Yes.
Through Operation Kindness. Thank you for being with us on the show today,
My
sir.
pleasure.
We have Crystal Jabiru with us as well, and she's been a teacher for over 13 years in our community, teaching 6th and 7th grade, I believe, as well, correct? Very involved in our community, very engaged with helpiraq.org, and a very active member of TEACH, a new organization started by Bishop Francis, Teachers Educating and Creating Hope. Thank you for being with us today.
Thank you for having me.
And we actually have the Teacher of the Year with us today. Melody Arabu is with us today, also teaching for 13 years. She's also a 3rd grade teacher. She was elected by the Michigan Department of Education through Superintendent Flanagan as Teacher of the Year for 2013 or 14?
2014-15.
Congratulations. So it's a very recent award. We're
Yes.
very happy to have you with us today. So with the wonderful panel, we've got lots to talk about, and we're glad that you all could come in. Dr. B, thanks for being with us today, man. We appreciate it. So first I want to start off with you. You're running for the Governing Board of Education. Let's talk a little bit about that. What made you decide to run? And let's start there.
Well, I graduated from Wayne State University School of Medicine in 1981. I've been on the faculty ever since 1988 when I finished my residencies, and so I think it's been 26 years now. And for that entire period, I've been engaged in teaching medical students and residents there. And so I'm in the trenches with them every day. I understand their problems. I feel their pain at a direct level because, like I said, I'm with them every day, and I know what they're going through. I have 6 children.
Wow.
And I would like for them to have the opportunities in future generations that I've had. And by that I mean I want them to get educated to the best of their abilities. And I think that the system that was in place when I came up was there to give me that opportunity. I want them to have it. And I see a lot of roadblocks being put up right now. And I'd like to actively get engaged in trying to take down some of those roadblocks.
Kill the red tape.
Yes, exactly.
Wonderful. Now, not a lot of people are familiar, like myself, of exactly what the Board of Governors does or what the qualifications are to run for one. Could you enlighten us a little bit?
Well, you know, there are, on each of the 3 major universities in the state, I believe Michigan State, it's called Board of Trustees.
Okay.
University of Michigan Board of Regents.
Right, yeah,
And,
Regents,
and
okay.
Wayne State University Board of Governors.
Okay.
These are statewide elected positions.
They're all kind of the same.
Yeah, we're all governing boards. We basically govern the operations of the university. We have
wow.
presidents in place to do the micromanaging with their administrations, but we're basically the representatives of the people overseeing the running of those universities, and that's why they're statewide elected positions.
I think the Board of Governors sounds cooler than Regents, and you know. So what are some of the qualifications you need to run?
Well, basically, you have to be eligible to run for public office in the state of Michigan.
So no felonies.
Correct.
Are we good there?
Exactly, yes.
Okay.
I think I
All
made
right.
that one. I was able to get that one erased, so I'm okay.
We're in good shape. Okay, great, wonderful, good. Well, thank you so much for being with us today. I have a question for you. Now we have this genocide that's happening overseas, this war of Christians, and we're seeing a huge influx of Iraqi refugees, Christian minorities coming into the community, and they want to further their education. From the university's perspective, what can the university do to help them with financial, academic, or counseling support?
Well, first of all, just think about it. Where's Wayne State University located? In the heart of Detroit, right? Who built Detroit? Immigrants. Isn't it? All 4 of my grandparents were born in the same little village in Sicily near the southern coast. They all came over near the turn of the last century. They didn't speak English. They had no education. They had no skills, no trades. And we ended up in Detroit, most of us, because it was a city of immigrants. And the immigrants built this city. Now, to show you a contrast in some of the problems between the universities, issues at U of M, University of Michigan, and Michigan State University are that a large portion of students are coming from out of state and international. in displacing our students out of state. We don't have that problem at Wayne State University. We're looking to boost our enrollment, and one of the proposals that has been made by one of my running mates, Satish Jasti, who's running also with me, has been to let's go to the immigrant population and let's boost our enrollment there. It was the immigrants who built this city to begin with. Let's go back to them. Let's give them the opportunity to get educated, and in the meantime, we can help boost our university with their presence.
Beautiful, beautiful.
Great idea.
And so that's a great way to help. And so is there, if you win, we're hoping you will, there's going to be some plans in place to reach out to more of those immigrant students to try and get them in the program?
If my running mate Satish Jasti and I are successful, that's one of our proposals.
Okay, beautiful. Thank you so much. Mr. Buru, thank you very much for being with us. We appreciate your commitment to education. Again, 13 years a teacher. And again, you're working with this new program that the Bishop's spearheading called TEACH. So tell us a little bit about it. I mentioned earlier what it stands for. Tell us again, but tell us what the objective or the mission of the program is.
The mission of TEACH stands for Teachers Educating and Creating Hope, is to make sure that the children that are internally displaced in Iraq are taken care of and comfortable as best as they can be as they prepare to start their lives over there, and maybe to prepare to come to this country or other countries, as many people are fleeing. So we want to make them as comfortable as we can.
So it's all related. So what types of goods and bad things have you seen so far from local high schools and colleges in terms of dealing with the refugee influx? I mean, in other words, what have they done to adapt so far, but what more do they need to do to prepare for this influx that we're expecting?
There is great work ahead. Because we have such a large population now from the war, the past 10 years. And I know some districts are doing, they're modifying their tests for them. They're doing extra help after school. They're getting outside groups, community groups to come and help and tutor. There's definitely room for improvement. There are some schools that are more open-minded. It definitely comes from the top-down management. Some schools are more open-minded about having socially just curriculum, and there are some school districts that are not ready to touch that yet because they have sort of a fear that it could start trouble. Sure. But the more they delay on that, the more stereotypes, the more discrimination.
What kind of trouble? What are they afraid of?
I think that they're afraid that it's going to further segregate people. I think that they're afraid that it might be a cause for fights, be a cause for other disruptions in the class. But if they do adapt these culturally relevant curriculums and programs, the kids can all work well together. Beautiful. And be friends, as they are in some districts.
Beautiful, I love it. Let's all play along in the sandbox.
That's the idea. It's just getting people on board to do it, and getting teachers trained and the students trained.
Well, thank you for being a very important part of that mission and helping it move it forward. And the Teacher of the Year, Ms. Arabu, is with us. Wonderful to have you with us. Thank you so much.
Thank you for having me.
Now, I know that we talked a little bit before the show started about some of the folks coming over suffering from PTSD, post-traumatic stress disorder. And you have a personal experience with that. Would you mind sharing that with us and then telling us a little bit about how you've seen it affect some of the students locally coming in?
Yes. So anytime somebody has experienced a traumatic event, it's recommended for them to seek help right away. And a lot of times what happens is if you don't, you internalize those feelings and they resurface later down the line. So in my case, we experienced a robbery when I was 18 years old, my parents and I, and I was encouraged to seek counseling, but I felt okay at the time, so I didn't. And it wasn't until about 2 or 3 years later, there was something else that had triggered, another fear, and then all of those feelings resurfaced. So, in thinking about what I experienced is such a small scale to what the people in Iraq have experienced. So I can't even imagine the level of trauma and the level of need that they'll have, and really the level of support that we're hoping to give them if they can come here. So, some things that you can look for and become aware of, especially, for teachers and for counselors or people in the medical field that might be working with these children that come over and the families that come over.
Even parents, right? Could look.
Definitely, the parents, anybody. The things that to look for are fear, anxiety, really irrational thoughts and fears, definitely stress, possibly depression.
So these are the symptoms you're describing.
Yeah,
for
these
everyone.
are symptoms and things to look for, and these things might not always appear right away. In my case, it wasn't until 2 or 3 years later.
Sure.
So something could trigger that trauma and all those feelings, like, it could be a sound. In my case, I had such a strong feeling that somebody had broken into my home when really that hadn't happened. But the important thing is to seek help for it and get it diagnosed, because in my experience, as soon as I knew what it was and there was a name for it, I instantly felt more comfortable. And I had a therapist and she gave me a book about it, and
You knew you're on the track to getting better.
I did. I just suddenly felt better because I was starting to understand all of the feelings that I had. And so through guidance with a therapist and through having an understanding of what the disorder is, that really helped me to overcome it. And so again, with the level of trauma that these people are experiencing, these are going to be things that we have to look for and be aware of so we can help them, especially kids in school, because it's already such a different environment
Right,
for
sure.
them, and they're going to take some time to adjust, and at any moment that can be triggered in them.
So when parents and teachers see the symptoms that you talked about, where do they go to get diagnosed? I mean, how do they know? Where would they go? Is it an internal medicine doctor who would do something like this, their basic primary care physician, or would it be a specialist of some sort? I mean, where do you go? If I'm a mom or dad and I see these symptoms in my son, what do I do?
Well, I think anybody in the
Tell
mental...
the audience too, they'd love to hear. Yeah.
Yes. I think anybody in the mental health field would be helpful to notice the signs and then also to give people the next step. So it could be a social worker at your school, it could be a counselor, it could be your medical health care professional, it could be a therapist. There are so many people that are available to help in these types of situations, and really the first and most important step is just to identify it and then ask for help in those cases.
So very important, when you see it, diagnose it, pay attention, and go get help. The earlier on you address it, the better, basically.
Right.
We can get you on the right path to help. Okay, got it? All right, good.
The Chaldean Community Foundation has programs.
So tell us about it.
The Chaldean Community Foundation has programs in place to help those who suffer from PTSD. They have a partnership with St. John's Hospital, and you can contact them, and they can give you the help that you need.
Another hot topic in education in schools is bullying. And I'm going to direct this one toward you, Ms. Arabu. You don't become Teacher of the Year without seeing bullying of some sort. So a two-part question here. Tell us what your thoughts on what the schools can do to help prevent it, and also what advice we can give to parents at home to either A, prevent their children from bullying others, or to prepare their children for who are being bullied by others, maybe how to handle the situation.
Well, I'd love to talk about this question. Actually, bully prevention is my passion, and I consider myself an advocate for it and hope to really communicate some messages throughout this role that I have this year. So from what I've seen, and even in children as young as 3rd grade, and I know it happens even younger than that, the biggest problem, especially for younger kids, is that the stereotypes of the bullies that they see on TV, that really big, dumb, mean guy that goes around pushing people into lockers, that doesn't really exist often in real life.
Right.
I've never come across that in elementary school. Or on the other end of that is the overly popular Valley girl in school that same thing as that mean girl syndrome. That also doesn't exist. So when
Or
you try...
O'Doyle syndrome. You remember, what was the movie with Adam Sandler when he went to school the first time?
Yes.
What was it called?
O'Doyle Rules, I think.
What was the name of the movie, though? Oh, come on. Billy Madison. He went back to school, remember? And then the big redhead with the freckles was like, O'Doyle Rules, and this whole crew. So they don't look like that necessarily.
No, and it's very rare for that type of person to exist that's a bully all the time.
Okay.
So when you try to explain to kids that their actions are bullying, they refuse to identify themselves with that because they don't see themselves that way.
Oh, I see.
So as soon as they start to understand that bullies don't exist, but we all act like bullies sometimes, then they're more willing to take responsibility for their actions and see it for what it is. So you
wow.
can say to a child, you know, you made this person feel this way, so what were you acting like? And they're willing to say, I was acting like a bully. Well, do you want to be a bully? No. And so then they start to change those. So really the communication that we use with them and the language that we use with them and getting them to look past those stereotypes and identify the bully, you know, in all of us, because
Wow.
we've all done that. We've all hurt people's feelings. We've all done things that, you know, have had a negative impact on people. That's key to start with kids. And you know, bullying is a very subtle thing. It doesn't really happen blatantly. You know,
Sure.
it's very quiet and it doesn't happen in front of authority. So as far as the victim side of it, we really need to teach kids and even adults the right communication skills to solve problems on their own rather than relying on the authority. So you teach them first to even say stop what you're doing, because oftentimes the other person doesn't even realize that they're bullying or that it bothers them.
Sure.
So expressing your feelings, something so simple as asking for an apology is so hard for kids. And you have to teach them and train them how to do that and feel comfortable doing that. And then the child who is doing the bullying needs to take responsibility for it and apologize, because that usually is what makes everything better. So I think that we can do some work on both ends, where we're helping bring the realization of what bullying really looks like, and then on the opposite end, when that's happening to you, what are the skills that you can practice in order to prevent those from happening again?
I mean, that's a picture perfect answer. I mean, just very well said, very, very well said. And you know, really, I think that the thing that's going to stick with me when I leave today is how you said that there's not kids, it's not a one kid who's a bully. All kids from time to time can act like a bully, so it's realizing that they don't want to act like that, and that's very well said. And obviously you see it in 3rd grade and maybe in 6th and 7th. Dr. B, in the college level, do we still see bullying? I mean,
You see it through all aspects of life, from the entire spectrum.
Sure.
You know, the difference between what I see and what she sees in terms of my level of students and residents that I teach is I'm dealing with adults.
Right.
And so most oftentimes when it's brought to my attention, I can get them to work it out amongst themselves. But when it gets to an extreme level as their supervisor, sometimes I have to get involved, make the decisions. I think, you know, I'm not a psychiatrist. I'm a plastic surgeon, but being a plastic surgeon, I'm being always accused of being a psychiatrist with a scalpel. But I think the most important point she brings up is recognition.
Sure.
In medicine, we call it diagnosis. You know, and if you make the diagnosis, you recognize and bring it to the surface, then oftentimes after that, the treatment becomes easy. It's
Sure.
the diagnosis recognition that is important. Not only to recognize that you're bullying or being bullied, but especially that you are bullying.
Sure.
Because sometimes kids are bullying and they don't recognize that they are.
I agree that recognition starts, you know, with
Yeah.
yourself.
I
And the
love
other
that
thing is-
term diagnosing
Yeah,
too. I
and
think
that's what we call it
something
in
that's
medicine
key.
and surgery. And I think another point I'd like to make is that don't assume, even in adults, that they know what bullying is.
Yes.
And don't assume that somebody's being bullied and recognize it as bullying.
Sure.
Well,
So-
and that's why bullying happens in the workplace as well. And then often I feel like people in our community and even refugees might feel that they're being bullied by the adults at the schools too. You know, we've heard complaints of, okay, this teacher isn't treating me properly, or the
Right.
administration isn't listening to us.
I got bullied by all my teachers.
Right, right.
I was
And-
always the victim.
Yeah, and
always
I think
the
it,
victim.
and it works the same way for adults. Adults, you know, the people who feel that way need to
Right.
communicate that to the adults, and the
Right.
adults need to be able to accept responsibility and change their approach, because 90% of the time in these situations, it's a miscommunication.
Sure.
Yes.
And that's the number one thing that I've seen with kids. And as soon as they start to just talk it out and take the time to do that, nobody has bad intentions. You know, you really need to assume positive intent in most people. And so I would like to give that message to everybody to
Sure.
really, you know, speak up if you feel that way, so that you don't feel like the authority is bullying you, and, you know, like you felt with all of your teachers.
Right.
What we really need too is good character education. Just start with just in the schools, but with parents. But as you've experienced, you know, you may not see it even with the adults, good character in them.
Sure.
But we definitely need to teach that compassion and that understanding in our schools, and hopefully that creates that ripple effect. we can all live in, one, harmonious community.
Beautiful, beautiful. And have you seen any specific bullying specifically geared toward the refugees coming in?
I haven't seen it specifically with my own eyes, but I've heard kids make certain comments that are very unkind. I find it being proactive helps. If I go right to them and say, "Why did you say that?" And I say things like, "If you have a question about it, maybe you can ask somebody."
Sure.
Or I talk about having that respect, that you don't shout that out loud and humiliate a group of people because it's rude. And we have to understand too, as educators, we may think it's rude, but they maybe weren't raised that way.
Sure.
And so we always have to take that in mind. I hardly will suspend students or write them up because I feel like they just don't know. If you teach them, hopefully they don't do it again.
And so, I mean, when someone's dealing with this, is it the best to go to their teacher, or is there a specific department in the school that you would go, counselor, or who do you go tell? And I mean, how do you get the help?
If a student is feeling bullied and feeling unsafe at school, that student should let their parents know, let their teacher know, let a counselor know, and we can talk about it. We can have a meeting, see what the root of the problem is.
Sure, and work it
have
out.
Have it figured out.
Yeah.
No kid should go to school feeling unsafe.
And to add to that, sometimes you have to speak up more than once, because we hear all these stories that get so extreme, and they say, I tried to reach out for help and people didn't believe me, or people didn't realize the extent of it. So speak up, and then speak up louder, and then shout if you have to, and keep reaching out to different people until somebody takes it seriously, because it is a very serious problem that can become extreme. And really the root of all bullying comes from differences. So these refugees that come here have so many differences, and the problem is that the people around them don't understand those. And so it's through that the generalizations happen, that the stereotypes happen, that the comments are made, and really it's just about creating that dialogue and taking away that ignorance, which will create that common ground between the kids.
Beautiful, beautiful. Thank you very much. We're going to take a quick break and we'll be right back.